Okay, so notice, let's go slow motion on this. That is kind of fun to listen to, right? What's going on, everyone? Dr. Todd from Gonstead Spine and Wellness. In this video, I'm going to go through a low back chiropractic adjustment review, the Gonstead method, what we do at our clinic out here in Meridian, Idaho at Gonstead Spine and Wellness. And if you haven't watched the other video we did, it was called Chiropractic Adjustment Review, I believe, or Chiropractor Reviews Adjustment. It was me going through and reviewing myself, going through cervical spine adjusting. So check out, you'll see something up above you can click on, you can jump over to that video. But on this one, we're gonna go through the low back because there's lots of questions that we have from patients asking us, can I crack my own back? Or when I twist like this, it makes a popping sound. How is that different than what you're doing when you crack my back? It's called an adjustment, by the way, called an adjustment. When we adjust your spine, what is it we're trying to accomplish? I'm gonna cover that in this video. I'm gonna go step by step, slow motion, frame by frame. I'm gonna show you a bunch of cool low back chiropractic adjustments utilizing the Gonstead method of chiropractic, talk about what we're trying to do with the Gonstead method. I'm holding a spine here so I can explain and really go through the mechanics. So this works for the public, for patients that want to understand what Gonstead chiropractic is, what specific chiropractic is. And this is also good for chiropractors who are wanting to learn more about chiropractic. Maybe you are a chiropractic student or practicing chiropractor who does the Gonstead work or some other method of chiropractic, and you're interested in learning more about Gonstead or interested in just bettering your own technique and focusing on some of the specifics that we do in the Gonstead method, which I feel is responsible for some of the level of results we are kind of known for getting in this work. So before I get started, if you haven't already, subscribe to this channel, and then you'll be in the know when we come out with our new videos. We come out with multiple videos every single week. We work so hard for you to edit these videos, to put them out, to figure out what content people want to see. Comment below, let us know what you want to see. Give us some ideas and we will try to capture some of this footage. We want to do educational stuff. We want to tell patient stories. We want to talk about segment, posture, movement, which is Gonstead is the segmental part, posture. We do curve correction in our clinic, so a lot of before and after x-ray work showing how we change structural alignment to the spine in a predictable fashion using chiropractic biophysics technique. And then functional movement, how we use corrective exercise and functional movement to fix abnormal movement patterns, to correct someone's abnormal movement that a lot of times gets them in this problem to begin with. That trio, the segment, posture, movement trio, is what we do in our clinic and what we teach other chiropractors how to put these things together so they can get the same level of results that we get out here. So make sure, like I said, subscribe, share the video, like the video, comment below. Understand we serve two audiences. One is the public, patients, and also we serve chiropractors. We teach chiropractors this stuff. So check out movenowu.com if you're a chiropractor. With that said, let's get rolling. Let's get started on this. Okay, let's pull up this low back adjustment over here. Now, let me just show you the video and then I'll explain what we're doing. Okay, so let me just play at normal speed. Makes a lot of noise. Now, believe it or not, we're not trying to just make a lot of noise, and the fact that made a lot of crunching noises and people think, oh, that was a really good one. That's not what we're trying to do. We're trying to actually cleanly isolate one joint, set one joint. Now, there are multiple sounds that can occur from one joint moving because there is a deep thud type sound that occurs from affecting the disc, and there's more of a higher pitch sound that occurs from affecting the facet joint or the posterior joints back here. So to really understand what makes this method different and what we're trying to accomplish in the adjustment itself, you have to understand the lesion or the problem that we're trying to correct, which is called a subluxation. It's a joint fixation. It's a misalignment of a joint. There's inflammation, restriction that occurs in a spinal segment. And we are first identifying which one needs to be adjusted. Aha, that's key. Knowing which segment to adjust. That's the most important part of this. Not just to rattle bones and try to make a bunch of noise, but to put a lot of emphasis into the analysis, into being as certain as we possibly can that the bone that we're going to put a specific thrust and motion into actually needs it. Novel concept, right? That's one of the things that differentiates this style of chiropractic compared to a lot of other stuff out there that looks to simply mobilize or increase motion in joints haphazardly, or just looking at the chiropractic adjustment as just another way to mobilize and create motion in the body. I'm not arguing that a chiropractic adjustment doesn't increase motion, and that's a good thing, but if a joint's hypermobile, that's not necessarily a good thing for one, meaning if a joint's already moving excessively, you don't want to necessarily put a thrust into that joint over and over and over again and move it even more, right? And another thing is, the spine is not just any type of joint in the body that we're just trying to get a cracking sound out of. It is a very complex joint that houses a spinal cord, or in the lower spine, the cauda equina. It's where the spinal cord ends and turns into a whole bunch of nerves that extend down through the lumbar spine and go into the lower extremities and organs and tissues and cells and everywhere else. So spinal cord is encased in the spine for one, and spinal nerve roots. It's not pictured on this model right here, but there is a spinal nerve root that exits in between every single vertebra, one on each side. When you put an adjustment into the spine, this creates a stimulus to the nervous system. That's a whole other video that we can talk about as far as the neurological aspects of chiropractic, what's been studied, what's been proven, what's been hypothesized, what we see clinically. There's absolutely a neurological component to this, and we have to respect that when we are adjusting a segment, it needs it, and we're not just doing it at will. I firmly believe that if you can make something better, you can make it worse. So if you move a joint that didn't need it, especially over and over and over again, I've seen this. Other Gonstead chiropractors talk about this. This is how we were brought up in the work. This is what we were trained on, is that something like 3 bad adjustments can actually create a subluxation. It can create a joint problem. I'm not sure if that's based on an actual study or anything. That was kind of an old adage that Dr. Gonstead used to talk about back in the day, but I think there's definitely some level of truth to that. Let's look at this adjustment again, and then we'll talk through what we're doing. So I'm finding a contact first off. So I'm using my top hand and I'm palpating, okay? So I'm palpating down to the exact part of the spine. In this case, it's a spinous process contact. So the spinous process is the bony prominence in the back. It's one of the best levers when we're pushing a vertebra forward to try to affect its motion and alignment. I'll get back to that in a second. I'm then using my piezoform, which is this part of the hand right here, technically the soft piezoform, so it's a more comfortable contact. So kind of this fleshy part of the hand that backs up to a ridge of bone called the piezoform. And I'm palpating the contact. I'm replacing, so I essentially put the tip of my finger on the contact. I'm then replacing the tip of my finger with that part of my hand. So I'm very exact. That's what I'm doing right now. And then I'm moving my top hand over here up onto the shoulder. And I'm not just pushing the shoulder backwards and twisting the spine. I'm trying to distract and traction, kind of a long axis distraction the spine to take some of the slack out of the lower back so that it's more ready for an adjustment. That's one of the key differences in the Gonstead work, is that we're not just trying to unzip the whole spine. We're not trying to push the shoulder one way, push the pelvis the other way, and make a bunch of noise all the way up and down. That's not what we're trying to do. When a spine adjusts like it does in this video right here, I don't necessarily celebrate over this. I say, oh, it moved, but I rattled it. So meaning it wasn't the cleanest adjustment. We had some other segments, some facet joints, these posterior joints, pop and click and release. And that gives me a mental note that I need to stabilize better. I need to make sure there's even less twist or rotation in the spine. And I know that this patient moves quite easily, so maybe I can put a slightly lighter thrust into this. Let me show you this and I'll talk more about what we're doing. So I'm pushing the shoulder up, not necessarily back. See, it already went clunk just from moving around her side. I'm not even putting any sort of like quick thrust into there. And then my leg, which you can't really see here, but it's my right leg, is stabilizing her pelvis into the bench here, into this table. It's called a pelvic bench. We're stabilizing this, we're compressing this into the bench, technically be this way, right? Compressing into the bench. And then my hand is contacting on the spinous process, and simultaneously as I compress into the pelvis and stabilize, I'm going to thrust, so it's going to be a quick explosive movement forward to move that segment forward. I'll explain why that's relevant in a second, I promise. Okay, so notice, let's go slow motion on this. That is kind of fun to listen to, right? So anyway, what I'm doing is I'm not twisting, I'm not shearing, so it's not a rotational adjustment. It's pushing what's called from P to A, from posterior to anterior, from back to front without twisting to set the vertebra forward. That is the cleanest type of adjustment, or the cleanest vector of thrust, the direction of thrust that we're aiming to accomplish when we go through this type of adjustment. Okay, so what I'm doing is as I roll her into position, I'm using my right leg over here and I'm pinning that into her pelvis to hold her pelvis into the table so that when I thrust, she doesn't roll, she doesn't rotate. It's pinned, it's locked into the table. Technically, this video is not a fifth lumbar adjustment. I'm adjusting a rotated sacrum. So this is a different joint. It's at the sacroiliac joint. We're still trying to be specific with it, but I definitely rattled some segments. It cleared the joint that I wanted to adjust. It took some innocent bystanders with it. That's not the intention of a Gonstead adjustment, but it's a similar type of setup that we're doing in the sense that we're pinning the pelvis into the table and we're trying to isolate the joint in the spine, in this case, in the sacrum and the tailbone, and push it forward, okay? So let's see that one more time, we'll move on to the next one. Okay, now something I want to mention before I move on, what are we trying to even fix to begin with? This subluxation thing, as far as how this is taught at the Gonstead work, as far as how we learn this is the front of the spine, this is the back of the spine, you have a bone, disc, bone, nerve comes out in between, spinal cord runs down the middle. With trauma, the bones can shift backwards out of alignment. That's called a subluxation. It's like a dislocation, only smaller. So the bone shifts backwards. The main component is fixation, restriction, and then swelling. That's how we find this. And there's other videos that we have in the past where we went through a full spine workup. We show how we analyze this thing. We show all the analysis time that goes in before we would ever feel comfortable putting a thrust into the spine. So once we've identified the segment and we are convinced that there's enough criteria to warrant an adjustment, we figure out how the vertebra is misaligned. Now, the primary direction of misalignment is posteriority, is backwards. The bone's misaligned backwards. There can be a little bit of rotation, left or right, and there can be what's called wedging, where it laterally bends to the left or the right. Okay, so it moves this way or it moves this way. I don't want to bend the spine too much, it's a little fragile. But essentially, the bone can go backwards to the left and then tilt up on that side. That's called a PLS, posterior left, and it's ridden up on the superior side of the wedge, which means it's laterally bent. Anyway, all those details go into how we're putting the thrust into the spine, but the main component of what we're doing in the Gonstead work is we're setting the bone from back to front without twisting. That's what I wanted to get down to. That's what we're trying to accomplish here. That's what makes this different. I was baffled when I learned that some chiropractic techniques don't even push with the hand. Like there's almost no thrust with the hand. It's all rotation. They're pushing the pelvis one direction, just randomly, wherever they want to contact. They're pushing the shoulder the other direction, and their goal is to unzip and make as much noise in the spine as possible. Now, here's why that is problematic, is because if you have a joint that's subluxated, if you have a joint that's fixated, and you're trying to be specific in your approach by finding and fixing that segment that's misaligned, it's stuck. It's not going to move very easily. Well, what happens in the spine, and other joints in the body as well, is that if you have one area that's stuck, you have multiple other areas above that that move excessively. It's called hypermobility. They move more to make up for the lack of motion because of the restricted joint in question. So here's my question to you. If you don't contact the segment that's stuck, and you got a bunch of segments that already move excessively, and you just very globally put a hand here, and twist the whole spine, what do you think is going to make all that popping and cracking sound? The one that actually was stuck and needed to move, or all the other segments that are already hypermobile to begin with? Yeah, ding, 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 you got it right. It's the hypermobile segments that are moving. You might make an impressive sound, but are you really doing anything to help the patient as far as to clear out the segment that needs to be adjusted? Some of this goes into just how we look at things with different chiropractic techniques. The way we look at stuff is you're finding the fixated segment, you're finding the problematic subluxated segment, and you're targeting that one. Okay, so let's just continue based on that premise, and let's just at least assume that that matters. All right, which I'm convinced it does matter. Let's move on to another video here. This is another low back adjustment. Patient's still laying left side up as well. This is a fifth lumbar adjustment. So this one truly is, we're contacting L5, we're setting it forward. Now, fifth lumbar is a very common segment to adjust. It's a very common segment to misalign. It's one of the most common misalignments in the spine out of anything. All right, let's take a look. Okay, let's watch this. Let's back it up. So notice she's pinned into the side there. She's not moving. I'm not jumping on her, okay? My pelvis doesn't move. My leg is pinning her leg comfortably into the table. She's not gonna roll. She's not gonna fall off the table. And my hand is contacting the segment. My top hand here is right here on the outside of the arm. Now, technically how they teach it is you're supposed to put the hand up here. I've always done it right here, like down towards the elbow almost. I feel like I have more control over it. And I'm distracting and pushing that arm up, not back. I'm not twisting back, I'm pushing up like this. And I'm doing that to try to avoid a lot of twisting, a lot of rotation. Okay, and then the thrust is coming from, boom, pushing this way, and my upper body initiates that motion, so it can be quick and it can be powerful to set the segment forward. Let's watch it one more time, slow motion. One more time. Okay, let's go on to another one. This is Emily, I believe. Her first adjustment ever, we pushed her fifth lumbar. She's had a lot of low back pain. She injured this lifting a patient in a nursing facility, and she's been hurting for months and months and months, and she is now doing amazingly well after only a couple of specific adjustments. Okay, kind of a funky sound there, but let's go through this. So now, just to answer one of the questions I opened with where, if someone says, hey, if I twist my back and I crack my own back, or hey, doc, can you crack my back? Like, thinking about this as cracking the back is the problem. We are not twisting and rotating the spine. Yes, there's some chiropractic techniques that do that, and they're probably pretty close to the equivalent of you just twisting in a chair and cracking your own back. This is setting a vertebra forward. There's a very distinct thrust from back to front. We are influencing that bone from back to front. We are influencing and affecting this joint deep down to the disc. That's the difference. This method, the Gonstead method, was designed with the intention of being able to address a subluxation as it pertains to the disc. It's a deeper type of adjustment. It's not just a superficial facet click is what it's called. So in doing so, there's a lot of technique, there's a lot of technical aspects to this. And this is something that no one can ever do on their own. It's impossible. I can't adjust myself. None of my patients can adjust themselves. Yeah, it's job security for us Gonstead chiropractors, but you need a skilled person to be able to adjust you. Types of conditions that people have, chronic low back pain, sciatica, which causes pressure on a nerve that goes down the leg. This like piriformis syndrome thing, it's almost always a fourth or fifth lumbar subluxation, sometimes a sacral issue. So many of these problems come from a lower lumbar subluxation. We can adjust L5 on the side with a push move, L4, L3, L2, sometimes you can go up higher. Typically, these lower ones are done with a push move. There's another move, and I don't have a video of it here, but there's another move, and I'll do a whole other video just on pull moves, especially for chiropractors who are watching this that really want to geek out on the technique. A pull move is really a finger push move. We're not twisting the spine, but it's a contact with the fingers instead of the piezoform, and instead of pushing this forward, you have the fingers here, and you're pushing this forward with the fingers. Slightly different move. It's great with smaller patients. It's great with really flexible patients. Sometimes it's great with really big patients that you need more speed. It's something where in these clips that I'm showing, they're all push moves. I probably do 50-50 push and pull moves with patients. And then depending on how the vertebra is misaligned, sometimes if there's a lot of rotation in the vertebra, it calls for more of a pull move because you can address the rotation if you want to in that move a little bit more. But anyway, all the technical stuff aside, let's just look at the adjustments, we'll talk through them. Okay, that was after. Let's back it up. As you can see, my pelvis does not move. I'm locked in place. I'm up on my toe on this back leg. There's not a whole lot of weight on this back leg. I'm not leaning on her a ton, but she's locked in position. Most of my weight's on my front leg. And as we go through this, boom. So just setting that vertebra forward, there's no twist, no rotation. Again, And I know I keep saying that, but that's an important thing to emphasize because that's one of the biggest differences between a chiropractic adjustment done with the Gonstead method. Now, keep in mind, this sideline technique, this was primarily coined and perfected by Dr. Gonstead, and then a lot of other methods have taken a Gonstead style technique and added a lot of rotation, removed some of the specificity. And again, I try to make these videos in a way where I'm not bad-mouthing anyone else. I'm pointing out the specifics of the Gonstead work. But I firmly believe being more specific is better. I think it makes more logical sense to be more specific. Yes, are there patients out there that you can give them a less specific adjustment and still get good results? Sure. But are there patients out there that are not going to do well if you give them a sloppy adjustment? Absolutely. And we've seen this time and time again. This is more of a experience type of thing, a case management type of thing. You know, seeing a patient that's been to multiple different chiropractors, they come into a Gonstead chiropractor for the first time, we give an adjustment, it clears them out after 1 or 2 adjustments. They say, oh my gosh, no one's ever been able to move it like that. Now I'm doing so much better. It's something that we hear over and over and over again. I've been doing this now for 18 years. I've heard it thousands of times. Do I have a peer-reviewed study to show it side by side? No. But peer review and study is one piece of the whole clinical picture as far as efficacy of care. All right. Okay, last one I'm gonna show you. Now this is a 5th lumbar adjustment. This is actually Jenna. We're gonna lift and set this up and forward is the goal on L5. L5 right over here. L5, we lift and set the vertebra forward. We're doing this face down in the prone position. It's called prone position. Piezoform contact, patient's laying face down. We're setting the vertebra forward through the plane line of the disc. That's the vector of thrust. We're not just pushing straight down. We're trying to arc, almost a lift and setting motion. And this is a case where Jenna, you know, she's young, she's in her 20s. Most of the time, 20-year-olds, we're setting them on the side. We're not doing it face down like this. Usually our older patients, more rigid patients, we're setting prone face down here. For whatever reason, Jenna sets better here. Okay. So I'm timing it, I'm waiting for her to relax.
Let it go. Legs loose. A little more.
Good. And that's it. So it doesn't sound as amazing here. I didn't have a microphone close enough, you know, but essentially we are trying to accomplish the same thing mechanically. We're doing it in a different position. There's multiple ways in the Gonstead work to adjust a 5th lumbar and still respect and use the same biomechanics that we're trying to do in a sideline pushing position. We can do it face down. There's a table called a knee chest table, which we also adjust on. Admittedly less often because most patients, I get just a great adjustment with them prone on the high-low table, this table here, or sideline with a push or a pull. But we have some patients that we do adjust on this other table called a knee chest table. I'll have to do another video just on knee chest table adjustments. However, my flow of how I've gotten into it, I don't use it as often as I do a high-low. Okay, it just takes longer to instruct the patient to get on and off. High-low tends to be easier for the patient, quicker, and so I have a knee chest, but I just don't use it a whole ton. Anyway, that's what I wanted to cover. I hope that I didn't lose you all in this. I know I got a little technical, but you know, our last video that we went into this in a lot of technical aspects, we got feedback from patients saying that they really loved learning this and understanding this from a patient perspective. And we had chiropractors, I had multiple chiropractors message me from different parts of the world, from different countries as well, saying, thank you so much for doing this, please make more. So we're making more. So comment below, let us know what else you want to see, and like the video, share it, subscribe to our channel if you haven't already. When it comes to the health of you and your family, results matter most.